Imagine taking just 30 milligrams of a medication that does the same job as 1,200 milligrams of another drug. Sounds impossible, right? But it's real. Today, we're diving deep into two powerful nerve pain medications. One has been around for decades, the other is the new kid on the block. And the differences between them might surprise you. So stick around until the end because we're going to reveal which one could be the better choice for nerve pain relief. Nerve pain affects millions of people around the world. It's that burning, tingling, shooting pain that just won't go away. And for years, doctors have been prescribing gabapentin to help patients find relief. In fact, gabapentin became one of the most prescribed medications in America with over 45 million prescriptions written in 2023 alone. But now there's a new player in the game called Mirogabalin. Scientists are calling it the next generation of nerve pain treatment. So, what makes it different? In this video, we're breaking down 10 key differences between Mirogabalin and Gabapentin. By the end, you'll understand how they work, which one is stronger, their side effects, and much more. Let's get started. Difference number 1: how they work. Let's talk about how these two medications actually work inside your body. Both gabapentin and mirogabalin target something called calcium channels in your nerves. Think of these channels as tiny gates that control pain signals. Now, here's where things get interesting. Gabapentin is like a shotgun. It goes everywhere and hits everything. It binds to calcium channels all over your body, including your brain. It doesn't really pick and choose where it works. Mirogabalin, on the other hand, is like a targeted missile. It's highly selective. It goes straight for the pain receptors and leaves other areas alone, especially the parts of your brain that cause unwanted side effects. This selectivity is a game changer. It means mirogabalin can focus on stopping your pain without messing with your brain function as much. Scientists spent years developing this precision. And this difference in how they work explains a lot of the other differences we're about to discuss. So remember this concept because it's the foundation of everything else. Difference number 2: strength and dosage. Now let's talk about something that will blow your mind. The strength difference between these two drugs is absolutely massive. Mirogabalin is roughly 40 times more potent than gabapentin. Yes, you heard that right, 40 times stronger. What does this mean in real terms? Well, taking just 30 milligrams of mirogabalin gives you the same pain relief as taking 1,200 milligrams of gabapentin. That's a huge difference. When doctors prescribe gabapentin, they usually start patients on 900 milligrams per day and can go all the way up to 3,600 milligrams daily. That's a lot of pills to swallow. With mirogabalin, the typical dose is just 5 to 15 milligrams twice a day. Imagine going from handfuls of pills to just 2 small tablets. This makes life so much easier for patients. Fewer pills mean better compliance. People are more likely to take their medication when it's simpler. Plus, it's easier on your stomach and more convenient when traveling. The potency difference is truly remarkable. Difference number 3: speed of action. When you're in pain, every minute counts. You want relief fast. And this is where another big difference shows up. Mirogabalin works incredibly quickly. After you take it, the medication reaches its peak concentration in your blood in less than 1 hour. That means you start feeling relief fast. Gabapentin, however, takes about 3 hours to reach peak levels. That's 3 times longer. Now think about what this means in real life. If you wake up with nerve pain shooting down your leg, mirogabalin starts working within the hour. With gabapentin, you're waiting around for 3 hours before you get maximum relief. This speed difference is especially important for what doctors call breakthrough pain. That's when sudden, intense pain hits you out of nowhere. The faster a medication kicks in, the better you can manage these painful episodes. For people dealing with chronic nerve pain, those extra 2 hours of waiting can feel like forever. Difference number 4: how long they last, but speed isn't everything. What about staying power? This is where mirogabalin really shines. Once mirogabalin attaches to those pain receptors we talked about earlier, it sticks around for a long time. The scientific term is dissociation time, and for mirogabalin, it's 11.1 hours. That's a very long time. Gabapentin, by comparison, has a much shorter dissociation time. What this means for you is simple. Mirogabalin provides more sustained, steady pain relief throughout the day. You don't get those annoying ups and downs where the pain comes rushing back before your next dose. With gabapentin, some people report that they can feel when the medication starts wearing off. They get this window where pain creeps back in before they can take their next pill. Mirogabalin's longer-lasting effect means smoother pain control with fewer fluctuations. You take it twice a day and you're covered. No watching the clock. No anxiety about timing your doses perfectly. Just consistent relief. Difference number 5. Side effects. Let's address the elephant in the room. Side effects. This is what everyone worries about when starting a new medication. Gabapentin is notorious for causing some pretty annoying side effects. The most common ones include dizziness, drowsiness, coordination problems, and brain fog. Many people describe feeling spaced out or mentally cloudy. Some feel like they're walking through water or can't think straight. Why does this happen? Remember how gabapentin is non-selective? It hits calcium channels everywhere, including in your brain. That's what causes these central nervous system side effects. Now, here's the good news about mirogabalin. Because it's so selective and quickly leaves brain receptors while staying on pain receptors, it causes fewer of these brain-related side effects. Don't get me wrong, mirogabalin can still cause some dizziness and sleepiness. But studies show these effects are generally milder and less frequent. Patients report feeling more clear-headed and functional. This is huge because side effects are the #1 reason people stop taking their pain medication. Better tolerability means better pain control. Difference number 6. Approved uses. Now let's talk about what these medications are officially approved to treat. This is important because it affects whether your doctor can prescribe them. Gabapentin has been around since 1993, so it has multiple FDA-approved uses in the United States. It's approved for treating seizures, postherpetic neuralgia, which is that nasty pain that comes after shingles, and restless leg syndrome. Doctors also prescribe it off-label for tons of other conditions like anxiety, migraines, and various types of nerve pain. Mirogabalin, however, is only approved for diabetic peripheral neuropathy and postherpetic neuralgia. And here's the catch. It's currently only approved in Japan and some Asian countries. It's not yet FDA approved in the United States or available in Europe. This is a major limitation. Even if mirogabalin sounds amazing, you probably can't get it unless you live in specific countries. The approval process takes years and requires extensive clinical trials. So for now, gabapentin remains the accessible option for most people worldwide. Difference number 7. Abuse potential. Here's something that might surprise you. Gabapentin has a known abuse potential. Yes, a nerve pain medication can be abused. It's become a growing concern in recent years. Some people misuse gabapentin to enhance the effects of opioids or to get a euphoric feeling. Because of this, several states in the US have actually classified gabapentin as a controlled substance. Kentucky, Michigan, and Virginia are among them. Doctors now have to be more careful about prescribing it. Mirogabalin appears to have a lower abuse potential, which is great news. Studies have shown that only at super high doses, about 4 to 7 times the normal amount, does mirogabalin show any abuse-like effects. Plus, it takes about 8 hours to reach peak recreational effects compared to just 1.5 hours for similar drugs. That long delay makes it much less attractive for abuse. This lower abuse potential could make mirogabalin a safer option in the future, especially as the world continues dealing with addiction problems. Difference number 8. Bioavailability. Let's get a bit technical, but keep it simple. Bioavailability means how much of the drug actually gets into your bloodstream and can work. Gabapentin has a weird problem. The more you take, the less your body absorbs. At lower doses, your body absorbs gabapentin pretty well. But when you get up to those higher doses, like 4,800 milligrams, your body only absorbs about 27% of it. That's terrible. you're literally wasting almost 3/4 of the medication. This is exactly why doctors have to prescribe such massive doses of gabapentin. They have to compensate for this poor absorption. Mirogabalin has much better and more consistent absorption across different doses. Your body takes in what you swallow more efficiently. Both drugs have similar protein binding rates, less than 25%, which means they're mostly free in your bloodstream to do their job. But mirogabalin's superior bioavailability is another reason why such small doses can be so effective. Better absorption equals better results with less medication. Difference. Number 9. Kidney considerations. Your kidneys play a huge role in how these medications work. Both gabapentin and mirogabalin are eliminated from your body through your kidneys. They don't get broken down by your liver like many other drugs. This is actually good news for people with liver problems. But if you have kidney disease, you need to pay attention. Both medications require dose adjustments if your kidney function is impaired. Your doctor will need to lower the dose to prevent the medication from building up in your system. If it builds up too much, you'll get more side effects. Before starting either medication, your doctor should check your kidney function with a simple blood test. And if you're on these medications long term, they'll monitor your kidneys periodically. The good news is that both drugs have similar considerations when it comes to kidney safety. Neither one is particularly harsh on the kidneys, but both need respect. If you have chronic kidney disease, make sure your doctor knows before starting either medication. Difference number 10. Availability and cost. Let's talk money and access because this matters in the real world. Gabapentin is available pretty much everywhere around the globe. Walk into any pharmacy in the US, Europe, Asia, or most other countries, and they'll have it. Plus, gabapentin has been generic for years now. You can get a month's supply for as little as $10 to $20 without insurance. That's incredibly affordable. It's been on the market since 1993, so there's no patent protection anymore. Mirogabalin is a completely different story. Right now, you can only get it in Japan and select Asian countries. If you live in the United States or Europe, it's simply not available yet. It hasn't gone through the FDA approval process. And when it does eventually become available in more countries, expect it to be expensive. It's a brand new patented medication. There won't be generic versions for years. We're probably talking hundreds of dollars per month. So, while mirogabalin might be superior in many ways, accessibility and cost give gabapentin a massive advantage. So, after all these differences, which medication wins? The honest answer is it depends. Let's break it down. Mirogabalin has some clear advantages. It's stronger, works faster, lasts longer, has fewer side effects, and has lower abuse potential. On paper, it looks like the superior medication. It represents real progress in pain management science. But gabapentin has its own powerful advantages. It has a proven track record spanning over 30 years. Millions of people have used it successfully. It's available everywhere. It's incredibly affordable. And doctors are very familiar with how to prescribe it and manage any issues. Here's the truth. There are no head-to-head clinical trials directly comparing these two medications. We don't have hard data showing one is definitively better than the other for pain relief. Mirogabalin shows tremendous promise as the next generation of nerve pain treatment. But for now, gabapentin remains the gold standard simply because it's accessible, affordable, and proven. Both medications have their place. The best choice depends on your location, budget, and individual response. Before we wrap up, we need to talk about some serious warnings that apply to both medications. First, both gabapentin and mirogabalin can cause serious breathing problems when combined with opioids. If you're taking any opioid pain medication, your doctor needs to know. This combination can be dangerous and even life-threatening. Second, never stop either medication suddenly. Going cold turkey can trigger seizures, even if you don't have epilepsy. These drugs need to be tapered down slowly under medical supervision. Third, both medications carry a warning about increased suicide risk in some people. If you notice changes in mood, increased depression, or thoughts of self-harm, contact your doctor immediately. Fourth, both require gradual dose increases when starting. Your doctor will start you low and slowly increase the dose. This helps minimize side effects. And finally, always take these medications exactly as prescribed under close doctor supervision. don't adjust doses on your own. These are powerful medications that require professional medical management. Your safety comes first, so there you have it. 10 key differences between Mirogabalin and Gabapentin. Let's quickly recap. Mirogabalin is the newer, more targeted medication with potentially better tolerability and effectiveness. It's 40 times stronger, works faster, lasts longer, and causes fewer brain-related side effects. But gabapentin remains the gold standard for now because it's proven, accessible, and affordable. It's helped millions of people manage their nerve pain successfully. The future might bring mirogabalin to more countries as it goes through approval processes. Maybe in a few years, it'll be as common as gabapentin is today. But we'll have to wait and see. Remember, this video is for educational purposes only. It's not medical advice. Always consult with your healthcare provider before starting, stopping, or changing any medication. If you found this information helpful, please hit that like button and subscribe to our channel. Drop a comment below and let us know. Would you try a newer medication like mirogabalin, or would you stick with a proven medication like gabapentin? We'd love to hear your thoughts. Thanks for watching, and we'll see you in the next video.